I'm talking to Dr. Kenneth Kornman. She is the President and Chief Scientific Officer for Interleukin Genetics. Dr. Kornman, thank you for joining us today. I want to ask you about PerioPredict, the genetic test that your company offers. Do you view PerioPredict to be a useful tool for dental hygienists in terms of patient education and risk assessment?
Well, first of all, Mark, thanks for the opportunity to talk about this today. Actually, as a periodontist, I know very well that our patients spend most of their time with dental hygienists. And to a great extent, the dental hygienist is the one most acutely connected to the patient in terms of their oral health as well as their overall health and well-being in general. The interesting thing about this particular test, PerioPredict, is that it identifies individuals who are at increased risk for severe, more generalized periodontitis, and it identifies individuals that cannot be identified by other standard risk factors such as smoking or diabetes or by routine clinical exam. So the real value to the dental hygienist, but most importantly, I think, to the patient, is that with this test, the dental hygienist knows, based upon the evidence that's been published, that individuals who test positive need more preventive care. That's number one. And number two, they're individuals where we know they're at increased risk for being on a path to severe periodontitis. And so it's an opportunity for us to be more alert in terms of monitoring those patients. So I think in general, this is very much an ideal fit for the dental hygienist because of the actions that would be taken based upon the test results.
So, if a dental office does not have the service yet, like the PerioPredict service, what do you think a dental hygienist should be discussing with his or her employer about the benefits of PerioPredict? What are some of the key points that you feel like dental hygienists should be discussing with doctors?
Yeah, it's an excellent question, and I think it's actually very straightforward. First of all, many offices are very much aware that in spite of their best efforts, many of their patients do not come in for their preventive care as frequently as the dentist and the hygienist would like. And in spite of the clear recommendations and input from the hygienist and the dentist, we know that a substantial number of patients choose on their own to come in only once a year instead of twice or more if needed, and some even come less frequently than that. So one of the, at least based upon the ADA's information, many of those individuals who come in less frequently do so because they believe that they don't need to be seen more frequently. They feel healthy, and they believe that they can judge the need for more frequent care if necessary. So the advantage of PerioPredict, and I think one strong indication for incorporating this in clinical practice, is that for individuals who are low utilizers of preventive care, even though they have good insurance coverage for more care, those individuals, if that information is very specific to the individual. It's not a public health uh, conversation. It's a specific personalized risk factor that allows the hygienist and the dentist to say to that specific patient, look, we know you look pretty good at this point. We know based upon your records that you're coming in less frequently than we would desire, but this test indicates that you're at increased risk. About 30% of the population will test positive for the PerioPredict test, and those individuals really do benefit long term from being seen more frequently. In addition, even if they have other risk factors, smoking is a good example, the data are very strong that having the PerioPredict positive test status actually amplifies the risk related to smoking. In one large study out of Europe, individuals who were smokers over a period of time, if they were also PerioPredict positive, they lost 5 times more teeth than individuals who were smokers but PerioPredict negative. And so that amplification of risk also is a good opportunity for the office to encourage that individual patient as to the need for more preventive care.
Can you clarify for me about what are the demographics of the types of patients that should be considered for genetic testing for periodontal disease? You were just talking about smokers, for example, but it's much broader than that, right? You take the position that all patients should be checked for genetic predisposition, or just a certain group, or what?
It's a very good question. So in general, the best way for offices to start is to focus on 2 groups of patients. The first would be those who are choosing on their own to come in less frequently than the office would prefer. And let's say patients come in regularly once a year. There are a lot of patients that do by their own choice. So for those patients, when they come in, if you also test those patients, explain to them based upon the information that we provide what this test means, and if they come back positive, then that's a strong indicator that they should be seen more frequently. We know it's been reported in the literature that if they're positive and they only come in once a year, they're at increased risk for more severe disease and for losing more teeth. So that's the first group. If they test negative, they may do just fine going once a year as they've been doing. The second group is the group that already has other risk factors. Those would be individuals such as smokers or individuals with a history of diabetes. And those individuals should be tested because the genetic test, again, amplifies the risk they have from those standard risk factors. Those individuals, based upon the evidence, actually would do better by more frequent cleanings than twice annually. And so that would be an indication for another group that should be tested in the office.
Thank you for answering the question. Before we leave, Interleukin Genetics provides a lot of great resources for dental professionals on the website. What do you recommend? If there is one thing that you would recommend a dental professional to view on the company's website, what would it be?
Yeah, so there is a website, PerioPredict, that has a lot of resource material for dentists and for hygienists. Some of it is video, some of them are webinars, short webinars, and that material is very concise, very good. We also have contact information for customer service people that can arrange for conversations with educators who are hygienists who can communicate and answer questions if the office has them.
And Dr. Kornman, you have been very generous with your time. Thank you for talking with us.
My pleasure. Thank you, Mark.